Good day, nurses. Today, for this recorded lecture, we are going to discuss your antibiotics. So, before we're going to start discussing your antibiotics, of course, alam naman natin na there are disease-producing microorganisms, no? That is actually causing us, okay, na tayo ay pwedeng magkasakit. Like, meron po tayong mga bacteria, may it be a gram-positive or gram-negative, mga viruses, or mga protozoans or even your fungi, wherein the degree to which they are pathogenic or kung bakit ito nagkakos ng sakit, nakadepende po kasi yan sa tinatawag natin na microorganism and of course with its virulence. Okay, so we have here of course, since antibiotics ang topics natin, we are going to discuss first your antibiotics. Okay, let's start first with your bacteria. Okay, sabi natin your bacteria, no? It is actually known as a prokaryotes. Okay, a single-celled microorganisms that lacks true nucleus and nuclear membrane. So usually most of your bacteria, no, they have actually a very rigid cell wall. Okay, I know for the fact that you already know kung ano bang ibig sabihin ng bacteria kasi I know that you already had with you your micropara, and even with your zoology in your first year, no? Sabi natin, your most of your bacteria have a rigid cell wall wherein, okay, and of course, as well as its structure, no? Nade-determine po natin yung mismong shape ng bacteria natin. Okay? And of course, one classification of your bacteria also involves yung mismong appearance, yung mismong shape, of course, under a microscope kasi we cannot see it visibly with our naked eye. We utilize your microscope para makita natin yung mismong appearance ng ating mga bacteria. Okay, so aside from that one, nakalagay dito, we have here your, we have here your basic cells of your bacterial cell. Basic shapes, I should say. Of course, kapag kapag meron kasi tayong dalawang, diba, we have your cocci, they're very common. We have your cocci and your bacilli or your bacillus, di ba? Kapag kasi yan, kapag rod shape yan, okay, rod shape yan, okay, organism, they are what we call your bacilli. And kapag spherical yan, or pabilog, they are your cocci. Okay? Wherein, yung ating mga yung ating mga bacteria na to, okay, they usually produces toxin. Okay, they produces toxin wherein this toxin usually cause what? It causes, I should say, cell lysis or cell destruction or cell breakdown. Yan po yung naproproduce ng ating mga bacteria, okay, ng mga toxins yan in our body that causes cell lysis or cell bacteria. Cell breakdown, I should say. Okay? So, many of your bacteria class, they usually produce yung enzyme na tinatawag natin. Nakakapag-produce po sila ng enzyme na tinatawag natin na beta-lactamase. Okay, nakakapag-produce po sila ng beta-lactamase na tinatawag. Wherein tong beta-lactamase na to class, yung ating mga beta-lactamase or yung mga naproproduce na enzyme ng ating mga bacteria, na sinisira po nila yung mga beta-lactam antibiotics natin. Ano ba yung mga example ng beta-lactam antibiotics natin? Madidiscuss natin yan later on. We have your Penicillins and your Cephalosporin. Wherein ang ginagawa kasi ng mga beta-lactamase sa class, sinisira po nila or ini-inhibit nila yung mismong action ng isang specific antibiotic para ito ay mag-work sana sa ating katawan. Okay, so we also have here your spiral. Kapag spiral naman kasi yan, class, ang tawag natin dun is your spirillum naman po. So here, these are the basic shapes of your bacterial cell. Okay, let's discuss with your cocci. Dito tayo sa cocci natin, class. Di ba meron tayong dalawang klase ng cocci? We have your streptococcus and your staphylococcus. Di ba? Pag sinabi kasi natin yan, class, pag sinabi natin cocci yan, sabi natin kanina, they are spherical shape bacteria. Of course, una, pag merong isang may isang cell yan, of course, tawag natin ng coccus. And kapag dalawa, diplococcus. And then, kapag yan, it appears in clusters. Okay, pag ang ating mga cocci bacteria na yan, it appears in clusters. They are what we call your streptococcus. They appear in clusters. Kapag sinabi naman po natin staphylococci, I should say baliktad, class. I'm so sorry. Okay, baliktad po. Kapag cluster yan, class, these are your staphylococcus. Okay, once a cell or a bacteria appears in a cluster, tinatawag po natin po silang Staphylococcus or Staphylococci. Kapag naka-chain naman po yan, okay, if it appears in chain or it is arranged in chain, they are your Streptococcus. So yan po ang ating mga bacteria. Ngayon, of course, if we are going to classify kung anong klase ng bacteria yan, we are using your gram staining na tinatawag. Sir, ano pang ibig sabihin ng gram staining natin? Your gram staining determines the ability of the bacterial cell wall to retain purple stain by a basic dye. Sir, ano pa yung usually yung ginagamit natin na basic dye? Probably, we are using your what? Your crystal violet. Okay, your crystal violet or your methylene blue kapag wala po tayong crystal violet na gagamitin. Okay, ngayon, how can we determine po, sir, how can we determine if that specific bacteria is a gram-positive or gram-negative? Kapag gram-positive yan, class, these bacteria are those whose cell wall retains a stain known as gram stain or resist decolorization with alcohol during culture and sensitivity testing. Sila po usually yung mga gram-positive bacteria natin, they usually retain a purple stain. Yun pang mga gram-positive na bacteria natin. How about with your gram-negative naman po, sir? Kapag sinabi natin gram-negative, of course, kabaliktaran lang yan, this bacteria lose a stain or are being decolorized by alcohol or sila po yung hindi nakakapag-retain ng stain. So, these are the classifications of bacteria using your gram staining na tinatawag natin. Ngayon, dito naman tayo sa ating meron din tayong mga, we are also going to tackle kung paano natin makaklasify yung mga bacteria na may it be anaerobic or anaerobic. Ngayon, pag sinabi kasi nating aerobic bacteria yan, class, usually these are bacteria, of course, it depends on oxygen for survival. Sir, ano pa yung mga examples ng ating mga aerobic bacteria? Of course, marami kasi yan, no? But we can actually identify yung iba. Okay? Of course, you have your Mycobacterium tuberculosis, the causative agent or the bacteria that causes your pulmonary tuberculosis. And of course, you also have your Nocardia asteroids tinatawag. Okay, so they are your just example of your aerobic. Pag sinabi natin aerobic yan, they usually depend on oxygen for survival. Okay, next naman tayo here with your anaerobic. Of course, kabaliktaran, this bacteria do not use oxygen for survival. Okay, so example dito are the bacteria associated with gangrene. Kapag nagkaroon ng necrosis or namatay yung mismo natin sa ating paa, usually nakikita natin yan sa mga patient na merong diabetes. Okay? So yung mga gangrene na tinatawag natin. So those bacteria associated with this one, they are considered as anaerobic or mga hindi nila kailangan ng oxygen para makapag-survive. Another, of course, example of your obligate anaerobes, no, are your tinatawag natin na Clostridium. Okay, your Clostridium botulinum. Okay, these are the Clostridium botulinum wherein tong mga to class, they usually kapag nakapag-ingest ka or nakapag-inhale ka ng Clostridium botulinum, pwede kang magkaroon ng paralysis, no? Or usually ito pa yung ginagamit nila for Botox. Okay, or Clostridium botulinum. Okay, so these are the aerobic and your anaerobic classification of your bacteria. Okay, let's proceed with your antibiotics na po tayo. Okay, so sabi natin sa antibiotics natin, these are substances, no, that inhibit bacterial growth or kill bacteria. And usually, we're using it for the treatment of your bacterial infection. So, these are your antibiotics. Kasi usually, class, yung goal naman po ng antibiotic therapy natin, it is actually to reduce, no, yung mismong population ng mga invading bacteria natin to a size that our human immune response can actually deal with it. So, actually, our antibiotics, they are made in 3 ways. Okay, they are made in 3 ways. Of course, usually by living or microorganisms. Of course, usually yung mga yung mga antibiotics natin usually originated from a specific living microorganism na ginamit natin. Okay, aside from that one, of course, by synthetic manufacture and of course, through genetic engineering. O, diba? Akala ko kasi kapag mag-record si sir ng mga madaling araw, mas peaceful. But mali pala si sir. It's already 2:02 a.m., no? Hindi kasi ako makapag-record na mabuti kasi nga, hindi magandang environment ko, hindi siya ganun ka-conducive, medyo maingay. But then, tawag dito, mali pala si sir. Akala ko, mas okay mag-record ng madaling araw, pero hindi. Mga aso pa lang kalaban ni sir, but it's okay. Okay, kailangan natin tong mai-record, okay? So, aside from that one, yung ating mga antibiotics kasi class, no? Sabi natin, it can actually inhibit a bacterial growth or it can actually kill a bacteria. Ngayon, meron pa tayong dalawang dyan. Parang function ng natin, ng mga antibiotics or action ng antibiotics natin. Of course, number one, we have your bacteriostatic or static or whatsoever. And of course, we have your bactericidal. Bactericidal na tinatawag. Okay, we need to differentiate these two para maintindihan niyo mismo yung action ng isang antibiotic later on. Okay, pag sinabi nating bacteriostatic or bacteriostatic ang isang antibiotic or action ng antibiotic natin, ang ginagawa po nito is usually what? It prevents or through preventing the growth or ini-inhibit niya po. Okay? Growth of your bacteria. That is your bacteriostatic or your bacteriostatic. Aside from that one, of course, we also have here your bactericidal. Pag sinabi natin bactericidal yan, class, of course, from the word itself, sidal, bactericidal, okay, mali kasi yung spelling ni sir, that should be bactericidal. Okay, medyo kasi sir, pagpasensya nyo, medyo dyslexic pagdating sa spelling, pagdating sa number, or whatsoever, okay? That is your bactericidal. Pag sinabi natin bactericidal from the word itself, sidal, ibig sabihin, it kills your bacteria directly. Yan po ang pinagkaiba ng ating bacteriostatic or bacteriostatic and your bactericidal na tinatawag natin. Okay, we have here your iba't ibang mechanisms, mechanisms of antibacterial action natin. Of course, number one, we have you have to memorize this one kasi possible pwedeng lumabas sa quiz or probably pwedeng lumabas pa sa exam ninyo. Number one, inhibition of cell wall synthesis natin. Usually, pag sinabi natin inhibition of cell wall synthesis, ang effect nito, class, is usually bactericidal yan. Okay, inhibition of cell wall synthesis. Therefore, kapag na-inhibit natin ang synthesis ng ating cell walls ng ating mga bacteria, of course, hindi namin makakapag-produce or hindi namin makakapag-replicate or dadami pa yan. Ibig sabihin, bactericidal po ang kanyang effect. Or ibig sabihin, ang nangyayari po, nagkakaroon pa kasi ng breakdown, ng ating mga enzymes of our cell wall. Therefore, kapag nagkaroon ng breakdown ng ating enzyme of our cell wall, hindi namin makakapag-reproduce or mamamatay po yan. Okay? And aside from that one, we also have here your alteration of your membrane permeability. Permeability, ibig sabihin, the ability of it to permeate or makapag-penetrate yan. Okay, nasisira po yung mismong membrane permeability natin. Ngayon, kapag ganyan, usually ang effect ng ating dito, it may be bacteriostatic or it can also be bactericidal effect. And of course, it also increases your membrane permeability. And of course, kapag nag-increase ang ating membrane permeability, it usually causes what? Cellular substances due to your cell lysis natin. Ngayon, next naman tayo here with your inhibition of your protein synthesis. Okay, di ba alam naman natin na ang ating protein, it's very essential, it's very vital for our bacteria for them to be able to survive. Okay, ngayon, kapag inhibit natin ang ating protein synthesis, ang nangyayari dyan, ang kanyang effect, it can be it can be bacteriostatic or it can also be bactericidal. Okay, and of course, sabi natin, inhibition, ibig sabihin it usually interferes with the protein synthesis without affecting our normal cell. And of course, aside from that one, it inhibits mismo yung step ng ating protein synthesis natin. Next naman here, we have your inhibition of your synthesis of your bacterial RNA and DNA. Wherein, yung ating mga antibiotics, they usually act by binding, nagbabind po sila sa ating mga nucleic acid and enzyme, needed for our nucleic acid synthesis para makapag-reproduce sila. Okay? And aside from that, last also, we have here your interference with cellular metabolism. Ibig sabihin, usually ang effect pag nagkakaroon ng interference with your cellular metabolism, it usually has a bacteriostatic, no? Bacteriostatic po ang effect nito, wherein yung mismong step ng metabolism within our cells, nagkakaroon po ng ng parang, maybe it inhibits, basta as long as it interferes with yung mismong natin, cellular metabolism natin. So, marami po tayong mga drugs dito, no? Mga example nito ng ating mga antibacterial action, na ganito po yung kanilang mismong mechanism of action. Ngayon, i-summarize natin, no? Pag yung mga antibiotics natin, wherein they usually belong to whatever mechanism of action natin, no? Of course, number one, we have your, dito tayo sa inhibition of cell wall synthesis. Anong mga example natin dito, sir? Probably, ang mga example natin, number one, kapag na-inhibit natin ang ating cell wall synthesis ng ating mga bacteria, example of this antibiotic is your penicillin. Okay, and even with your cephalosporins natin. Or marami pa yan, class. Also your vancomycin, okay? And aside from that one, we also have here your alteration of your permeability, membrane permeability. Number one, we have your nystatin yan, class. Okay? And aside from that one, for your inhibition of your protein synthesis naman po, we have your what? We have your aminoglycosides natin. Aminoglycosides, mga tetracyclines, your macrolides, mga ganyan. They usually inhibit your protein synthesis ng ating mga bacteria. And of course, you have here your inhibition of synthesis of your bacterial RNA and DNA. Of course, we have your very own fluoroquinolones. And last, of course, for your interference with cellular metabolism, anong example ng antibiotic nito? We have your what? Sulfonamide. So, ulitin natin, ano yung mga mechanism of action ng ating antibacterial or antibiotics. Number one, inhibition of your cell wall synthesis, I should say. Next, alteration of membrane permeability. Next, you have your inhibition of your protein synthesis, inhibition of the synthesis of your bacterial RNA and DNA. And lastly, we also have your interference with your cellular metabolism. Sabi natin, our antibiotics are made in three ways. Ano yung mga yon? It can be by living microorganisms, by synthetic manufacture, and of course, through genetic engineering. Sabi natin, merong dalawang action ng ating antibiotics. May it be a bacteriostatic, and we also have your bactericidal. Pag sinabi natin bacteriostatic yan, ang ginagawa niya, it prevents the growth or it inhibits the growth of your bacteria. Pag sinabi naman natin bactericidal yan, it kills directly your bacteria. So, that is your antibiotic natin. Okay. So, bago tayo mag-proceed, dapat, of course, alamin natin yung iba't ibang classifications or major classes, no, of your antibiotics. Ano ba yung i-discuss natin? We have your aminoglycosides, we have your carbapenems, or yung mga beta-lactams antibiotics natin. We have your cephalosporins, ano pa ba? Your fluoroquinolones, your penicillins, and of course, your sulfonamides, your tetracyclines, and of course, last will be your antimycobacterium or your anti-TB drugs that will be discussed separately. Okay? So, of course, ito muna tayo sa ating mga nursing interventions or nursing considerations when we are going to administer your antibiotics. Number one, okay, always remember this one, bago po tayo magbigay, no, prior administration of your antibiotics, we need to always remember this one, that we need to determine muna yung mismong causative agent ng ating bacterial infection, for example. Okay, the causative agent must be identified first through what? Through culture. Okay, and aside from that one, by determining yung mismong which antibiotic, no, usually is actually effective, no, will effectively interfere with mismong causative agent natin, okay? Kailangan muna natin ma-identify yung mismong or causative organism ng bacterial infection natin. Okay, of course, bakit kailangan, sir? Of course, para ma-determine natin, no, kung anong antibiotic usually ang mag-work or mag-interfere dun sa mismong causative organism na yan. Okay? Next, aside from that one, we also have to, aside from that one, we need also to undergo your sensitivity testing. Pag sinabi nating sensitivity testing, it must be done, no, para ma-determine natin which which that particular organism or yung mismong causative organism natin is usually most sensitive. Okay, most sensitive para ma-determine natin kung yung mismong antibiotic na yun, it can best kill or control yung mismong production or reproduction ng bacteria na yan. That is your culture and sensitivity testing. Prior administration, kailangan po nating mag-undergo ng culture and sensitivity testing para ma-determine natin which antibiotic will interfere or effectively treat yung mismong bacterial infection natin. Okay? Kasi for example, kaya masabi natin, no, kailangan talaga ng prescription yung ating antibiotics kasi you cannot take your antibiotics tawag dito without any prescription. Hindi ka pwedeng mag-take ng antibiotic ng basta-basta kasi you don't even know kung anong bacteria or yung mismong causative organism ang nagkakos kung bakit ka nagkakaroon ng infection or sakit. Okay? And of course, aside from that one, we also have here, nakalagay dito, antibiotics are given in combination. Of course, we can actually combine your tawag dito, antibiotics. Diba sabi natin, meron tayong mga pharmacodynamics interactions, we have your additive, we have your synergistic and your antagonistic effect, di ba? Of course, if you're going to give your antibiotics in combination, meron po tayo kasi mga combination antibiotics, no? They can possibly have what? Synergistic. Okay, they can have a synergistic effect. Wherein, ibig sabihin nun, pag pinag-combine mo, pag sinabi natin synergistic yan, no? If you're going to combine your antibiotics, they can have a greater, no, than their effect if they are given individually. Pag pinag-combine mo sila, mas magandang kanyang effect, mas greater ang effect, compared kapag binigay mo lang yung mismong isang antibiotic individually. Okay? So, aside from that one, we have here your prophylaxis. Okay? Ginagamit din po natin yung ating mga antibiotics as prophylaxis, no? In some certain situations, your antibiotics are actually used as a means of prophylaxis. Para saan? Para makapag-prevent tayo ng potential infection. Prevent potential infection. Ibig sabihin nito, class, ibig sabihin nito, for example, you are going to undergo surgery. So, you are actually have a high risk to develop possible post-operative infection. So, para maiwasan natin yun, we are going to give you an antibiotic to serve as a prophylaxis. Okay. Before we're going to start with your, mga classes ng antibiotics, we need to remember this one. Okay. So, meron tayong tinatawag na resistance. Okay, meron tayong tinatawag na resistance. Okay, so here are the different reasons kung bakit po tayo nagkakaroon ng resistance sa mga antibiotics natin. Ibig sabihin, hindi na po nagwo-work yung mga antibiotic na binibigay sa atin because nagkaroon na tayo ng possible resistance. Okay, or ibig sabihin yung mga causative organisms natin or yung mga bacteria natin, hindi na po sila tinatablan ng mga antibiotic na binibigay sa atin. Ano ba yung mga reasons, sir, kung bakit tayo nagkakaroon ng possible resistance? Number one, if you're taking your antibiotics for a long period of time. Okay, possible po kasi na magkaroon ka ng resistance or yung mga microorganisms natin or yung mga bacteria natin magkaroon ng ng resistant dun sa antibiotic na binibigay natin kapag tinitake mo to for a long duration or long course of time. Bakit, sir? Kasi sabi natin, class, yung mga antibiotics natin, hindi lang po yung mismong mga causative agent ang pinapatay nila or ini-inhibit nila. Usually, nasisira din po nila or napapatay nila ang ating mga normal flora in our body. Tandaan niyo, nasisira din po nila ang normal flora ng ating katawan. Okay, aside from that one, always remember, aside from your taking your antibiotic for a long period of time na nagkakos ng resistance, possible din po if you did not complete. Okay, does not complete yung mismong time na binigay sa'yo or sinet sa'yo para i-take mo yung mismong antibiotic mo. For example, sinabi ng doctor mo, you have to take your antibiotics for 7 days. You have to take it 7 days. For 7 days. Kasi possible, kapag hindi mo tinapos yan, hindi porket parang, okay na yung nararamdaman ko, medyo okay na yung pakiramdam ko. Okay, wala naman akong masakit or whatsoever. That doesn't mean na okay na. Okay? Or you're already treated for your specific bacterial infection. Hindi po. kailangan po matapos yung mismong course or yung mismong treatment or regimen natin for that specific, kung ano man yung isasuggest sa'yo ng doctor for you to take your antibiotics para hindi ka po magkaroon ng resistance. Okay? And aside from that one, possible din po na magkakaroon po tayo ng resistance if we are having or if we are being administered a large dose of your large doses of your antibiotic. Kaya hindi po talaga maganda na palagi po tayo nag-take ng antibiotic class. Okay? Kasi aside from that one, sabi natin, possible na magkaroon ka ng resistance kapag if you're taking your antibiotic for a long period of time. Aside from that one, kapag hindi mo tinapos, no, yung mismong pagtatake mo ng antibiotic, and of course, if you're being administered with a large doses of your antibiotics. Sabi natin kanina, sir, no, sabi mo, sir, nagkakaroon ka ng, or nasisira po yung mismong normal flora ng ating katawan. Okay. Meron po tayong tinatawag here na super infection. Okay, pag sinabi po kasi natin super infection yan, class, this super infection is actually infection no, due to decrease in your normal flora. Okay, due to the decrease in your normal flora na tinatawag natin. Therefore, kapag nagkaroon tayo ng masyado na mababa yung mismong mismong normal flora natin, of course, we tend to develop super infection. Mas mataas na po yung risk natin para magkaroon ng super infection na tinatawag. Okay? Paano po tayo nagkakaroon usually ng sir? Always remember this one. For you to develop a super infection, the more broader the antibiotic, ibig sabihin, yung mismong antibiotic natin, it can actually treat a gram-positive and gram-negative bacteria, the more na mas prone tayo para magkaroon ng super infection na tinatawag. Okay, sabi natin, the more broader the antibiotic, ibig sabihin ng more broad spectrum, ibig sabihin it can actually kill or inhibit a gram-positive and gram-negative bacteria, the more prone for us to develop your super infection na tinatawag. Okay, number one, pansinin nyo if you're taking your antibiotics, usually ang side effects talaga lahat ng antibiotics natin, diarrhea. Bakit po tayo nagkakaroon ng diarrhea? It's because sabi natin, nasisira po ng ating antibiotics ang mga normal flora in our body, of course also in your intestines. Kaya ka nagkakaroon ng ating diarrhea. Pag sinabi nating diarrhea yan, that is usually caused to your bacteria or using of your antibiotics. Yun po yung tinatawag natin na pseudomembranous colitis. Okay, pseudomembranous colitis. Or in other words, okay, yung pseudomembranous colitis natin, wrong spelling, okay? Ayusin ko yung sulat ni sir para maintindihan niya. Yung mismong pseudomembranous colitis natin, class, it can also be referred also as your C. difficile. Okay, that is your bacteria that is your diarrhea associated with or in relation with your that is your diarrhea that is related with your bacteria. Okay, yan po yung tinatawag natin na C. difficile or your pseudomembranous colitis natin. Okay? Next naman tayo here with dito na tayo, mag-start na po tayo with your major classes of your antibiotics natin. Okay, let's start first with your aminoglycosides natin. Let's start first with your aminoglycosides natin. Okay? Pag sinabi nating aminoglycosides yan, class, this antibiotics usually is being used to treat serious infections caused by what? Okay? By gram-negative aerobic bacilli. Yan po ang mismong ginagamit natin to treat serious infections caused by your gram-negative aerobic bacilli. So itong mga aminoglycosides natin, class, they are actually what? They are a group of powerful antibiotics natin. Of course, para hindi natin makalimutan kung anong mga antibiotics under your aminoglycosides. Okay, aminoglycosides include what? We have here your hashtag angkas-to. Okay, we have your hashtag angkas-to. Okay, that is your aminoglycosides. A for what? We have your amikacin. Next, for your letter N, we have your what? Neomycin. Aside from your letter A and letter N, we also have your letter G. Pag sinabi natin yung letter G yan, that is your gentamicin. And aside from your letter K, for your letter K, I should say, we have your kanamycin. For your letter S, we have your streptomycin. And for your to, we have your tobramycin. Pansin natin, pag sinabi kasi nating aminoglycosides yan, possible, it can be asin or mycin ang kanyang suffixes. Ulitin natin, your aminoglycosides, ginagamit natin yan to treat serious infections caused by what? Gram-negative aerobic bacilli. And your aminoglycosides include what? We have your hashtag, ang kasto. For A, we have your amikacin. For N, we have your neomycin. For G, we have your gentamicin. For K, we have your kanamycin. For your S, we have your streptomycin. And for letter T or to, we have your tobramycin. Okay, so pag sinabi kasi nating ano na yan, aminoglycosides, di ba? Ito yung mga klase ng antibiotic under your aminoglycosides. Usually, class itong neomycin natin, ginagamit natin to for what? Ginagamit natin to treat your, in the case of your, tawag dito, liver cirrhosis, no? Pag nagkaroon ka kasi ng hepatic encephalopathy, masyadong mataas yung mismong ammonium natin in our body, wherein kapag mataas ang ammonium natin, kailangan po natin gamitin yan ng lactulose para matanggal in conjunction with your neomycin. Okay? And aside from that one, we also have here your streptomycin. Your streptomycin kasi yan, class, ginagamit din yan as an anti-TB drug. Your streptomycin natin. Okay, so aminoglycosides class, ang kanyang action, they are usually bactericidal. Ibig sabihin, pinapatay po nila directly ang ating mga bacteria by what? By inhibiting your protein synthesis in susceptible strains of your gram-negative bacteria. And then these drugs are used to treat serious infections caused by what? Susceptible strains of gram-negative bacteria. Ano ba yung mga gram-negative bacteria natin? It includes your what? Number 1, we have your Pseudomonas aeruginosa, your E. coli, okay? Your protease species, the Klebsiella enterobacter, Sriracha group, we have your Citrobacter species, and of course, we also have your Staphylococcus species, which is your Staphylococcus aureus. Ang kinakalagay din dito, your aminoglycosides are poorly absorbed by the GI tract but rapidly absorbed after IM injection, reaching peak levels within 1 hour. Okay, by the way, you have to remember this one. Whatever route of administration yan, particularly kasi class, or specifically kapag IV kasi yan class, sabi natin yung mga antibiotics natin, they are very potent or masyadong malalakas yung mga yan. Therefore, it can actually cause what? Sensitive yan sa ating mga veins that will actually result to what? Phlebitis. Okay, magkakaroon ng inflammation of our veins due to your antibiotics kasi masyadong malalakas yan. Plus, therefore, paano po tayo makapag-prevent ng phlebitis? Plus, by what? By, pag IV push kasi yan, you have to administer it slowly. Pag antibiotics yan, class ha, you have to administer it slowly para makapag-prevent po tayo ng tinatawag na phlebitis natin or even possible infiltration. Matatanggal po yung mismong line natin. Therefore, kapag nagkaroon ng phlebitis yan, of course, masakit yan. Kaya bagong hanap na naman ng ugat para maglagyan ng ating line. Ganun po yon. Okay? Of course, ano yung mga contraindications? No? What are the contraindications and cautions when we're going to administer your aminoglycosides? Number 1. Of course, we have here your allergy, known allergy to any of the aminoglycosides natin. Of course, hindi po yan pwedeng ibigay sa kanila if they have known allergy sa mga ganitong klaseng antibiotic. Bakit? Possible kapag nagkaroon kasi ng hypersensitivity or allergy sa kapag binigay mo yan, of course, magkakaroon yan ng reaction. And kapag napabayaan mo yan, it will lead to what? Anaphylactic shock natin or anaphylaxis natin. Okay, and of course, we have here your renal and hepatic disease and of course, pre-ear or pre-existing ear problem. Okay? So, bakit contraindicated sa mga patient na mayroong renal or hepatic diseases? Of course, it's because in the first place, your aminoglycosides or yung mga antibiotics in general, they are what? Hepatotoxic and nephrotoxic. Okay? So, next here, We have here your adverse effect, yung mga common lang na adverse effects yung di-discuss natin. Okay, yung CNS effect or your, tawag dito, your central nervous effect ng ating ng ating aminoglycoside, they are called your what? Remember this one. They are ototoxic or ototoxic. Nagka-cause siya ng ototoxicity. Okay? Ano ba yung mga manifestations ng ototoxicity na? Of course, number one, kapag ikaw ay nagkaroon ng irreversible deafness or nagkaroon ka ng pagkabingi, okay, because of your aminoglycosides, no? That is actually an adverse effect of this antibiotic. Possible na magkaroon ka ng irreversible deafness, and of course, possible din ng mga vestibular paralysis, no? Resulting from the drug effects on our auditory nerve, no? Okay, and of course, possible na confusion, mga ganyan. Basta CNS manifestation yan. You should always remember that kapag ang ating antibiotic nagkakos ng ototoxicity, anong number one na kailangan nating alamin? Of course, number one, you have to what? We have to check for the auditory testing. Kailangan natin mag-conduct ng orientation, no? And even possible, auditory testing natin. Kapag ang ating antibiotic, bago tayo magbigay ng aminoglycosides sa patient natin, kailangan nating auditory testing. Bakit, sir? Kasi in the first place, your aminoglycosides, possible adverse effect is what? Ototoxicity. Okay, para ma-evaluate natin yung CNS effect of your drug, kailangan nating what? Mag-auditory testing natin kapag nagbibigay tayo bago tayo magbigay or prior giving your aminoglycosides. Or pwede nating i-assess by what? By how? Kapag for example, nakapag-take na ng aminoglycosides si patient, kailangan nating i-assess kung okay bang kanyang pandinig. Okay? And aside from that one, we also have here your renal toxicity. Sabi natin, bakit kailangan nating i-hydrate? Okay? You have to hydrate or instruct your patient for hydration at all times during your drug therapy of these aminoglycosides para ma-minimize natin yung mismong renal toxicity na tinatawag natin by how? How can we hydrate your patients? By increasing their oral fluid intake. And aside from that one, we also have here your possible bone marrow depression. Of course, ito yung mga nakakatakot, no? Kapag nagkaroon ka kasi ng mga ganito, it's because, sabi natin, adverse effect that is actually untoward, no? Or unexpected effect of this medication. And aside from that one, we also have here your GI effects. Okay? Pag nagkaroon ka ng GI effects, of course, what you really need to do is to what? You have to take your antibiotics or your aminoglycoside with meals, di ba? Kailangan with meals yan. Okay, with meals para hindi masyadong irritant sa ating tiyan. And of course, kailangan natin i-treat yung mga symptomatic natin, no? Like your mga nausea and vomiting natin. Anything na GI distress yan. Okay, and aside from that one, for cardiac effects, usually, nagkakaroon po tayo ng possible palpitations if you're going to take this one. Therefore, what are you going to do? You have to monitor your what? You have to do your, establish your baseline data, no? To assess your effectiveness of your drugs. In occurrence, kapag nagkaroon ka man ng possible na adverse effect natin. Okay, and aside from that one, we also have here your hypersensitivity reactions. Ano ba yung mga possible, ng hypersensitivity reactions natin? Mga manifestation yan, it includes what? It includes mga purpura. Okay, very common this one, your rashes. Okay, your urticaria. And of course, we have your exfoliative dermatitis. Okay, anything na yan, in our skin, they can actually be a manifestation na nagkaroon ka ng allergic reaction or hypersensitivity from this class of your antibiotics. That's why it's very important for us when it comes to our vital signs talaga. Kailangan nating yan. And of course, with your physical assessment para makapag-establish tayo ng baseline data if we can give your antibiotics of this type of antibiotics to your patients. Ulitin natin, ang ating mga aminoglycosides, ang number one talaga na effect ng aminoglycosides natin, class, number one talaga yan is your ototoxicity. Okay? Aside from your auditory nerve, ano ba usually yung tawag natin sa cranial nerve natin that is being affected? Kapag nagkaroon tayo ng ototoxicity, we have your cranial nerve number 8. Diba? Okay? And aside from that one, we have here your renal toxicity. Anong gagawin natin kapag possible nagkakos yan ng renal toxicity? We have to hydrate your patient at all times. By how? By increasing their oral fluid intake para ma-excrete po natin yung mismong metabolites sa mga mismong drugs na ito sa ating katawan. And of course, pag sinabi natin bone marrow depression yan, it usually what? It has and effects. Sabi natin, hindi lang po yung mismong antibiotic ang mismong, yung mismong bacteria ang tinatamaan ng ating mga antibiotics. Therefore, it also have a direct drug effect sa ating mga rapidly dividing cells natin in our bone marrow. Okay, that's a direct effect in our rapidly dividing cells in our bone marrow. Therefore, it will lead to what? Possible immune suppression or immunosuppression, and of course, possible na super infection. And for your GI effects, sabi natin, ano ba yung mga possible GI effects natin? Of course, we have your what? Yung mga nausea, yung mga vomiting, and even possible diarrhea. Kasi nga, it's because of the result of your pagkasira po mismo ng normal flora ng ating GI system. Okay, and aside from that one, we have your cardiac effects. Possible kasi na magkaroon ka ng possible what? Palpitations. Aside from your palpitations, possible na hypotension or even pagtaas ng BP, your hypertension. That is why it's very important for you to assess your vital signs para ma-monitor natin yung mismong cardiovascular effects ng drugs na to. And aside from that one, for your hypersensitivity, ibig sabihin, possible na magkaroon ka ng reactions like your purpura, your rashes, and even your urticaria. Okay, this is your aminoglycosides natin. Next naman tayo, we have here your Carbapenems natin. Your Carbapenems class, they are relatively new classes. Okay, mga bago to, no? Of broad-spectrum antibiotics. Ibig sabihin ng broad-spectrum, it can actually kill or inhibit a gram-negative bacteria and a gram-positive bacteria. And they are effective against gram-positive and gram-negative bacteria. Your Carbapenems usually class, they include what? We have your hashtag DEMI. Kung sa ating aminoglycosides, we have your hashtag angkasto. For your Carbapenems, we also have your hashtag DEMI. Let's proceed with your number 1. Pag sinabi nating letter D, your letter D is your. We have your, ano yung letter D natin? We have your, sorry, wait lang class. Kailan ko lang uminom ng tubig? Wait lang po. Okay? Okay, so we're back. Okay, so we're back. Let's continue with this one. Pag sinabi nating letter D yan, class, we have your, ito kasi mahirap pag recorded lecture, hindi ka pwedeng mag-post, no? Okay, so for your letter D for DEMI, we have your Doripenem. Okay, mabilis lang po mag-memorize ng Carbapenems natin. Anything that, antibiotics that ends with your penem na suffix, they are considered as Carbapenems. So we have your letter D for Doripenem. Wait lang, class. Okay, we have your Doripenem. For letter E naman po, your letter E, we have your Ertapenem. Okay, we have your Ertapenem. And for your letter M naman po, we have your Meropenem. And for your letter I, we have your Imipenem. So anything that ends with your penems, they are considered as what? They are considered as Carbapenem natin. Okay, so we have here your Carbapenems are considered as bactericidal. Ibig sabihin, it kills directly your bacteria. By how? By inhibiting cell membrane synthesis in susceptible bacteria, leading to possible cell death natin. Okay, and aside from that one, they are indicated for treating serious intra-abdominal urinary tract, skin and skin structure, bone and joint, and of course, gynecological infections. And of course, these drugs are rapidly absorbed if given IM, okay, and reach peak levels at the end of the infusion if given intravenous. Okay? So, you have to remember this one. Okay, your Doripenem is actually the newest drug of class under your Carbapenems, and it's usually given what? By intravenous every 8 hours by 1 or IV infusion for 5 to 14 days. At so yung pinakabagong ano natin, pinakabagong, what do you call this one? Pinakabagong drug natin under your Carbapenems, you have your Doripenem natin. And of course, kanino contraindicated or we're going to take cautious or precautions when we're going to administer this Carbapenems. Of course, palagi pa rin yan, no? Your known allergy. So it's very important for you to check for your culture and sensitivity reports to ensure that this is actually the drug of choice for this patient. Of course, pag nagkaroon ka ng hypersensitivity reactions, of course, kailangan mong i-monitor yan kung magkakaroon ka man ng rashes. No? Kahit simpleng rashes lang yan, ibig sabihin yan, class, possible na allergic siya sa mismong isang medication. By how, sir? Paano ba natin ginagawa yung test natin for that allergy? Diba? Kaya nga tayo nag-skin testing, no? Bago tayo magbigay ng antibiotics natin. Para makita natin kung pwedeng possible na allergic ka sa isang specific na antibiotic. Okay? And aside from that one, we have here your, or to any beta-lactams, possible na mga, hindi natin to pwedeng ibigay sa mga possible na may seizure disorders, meningitis, and of course, lactating mothers. Okay, ibig sabihin kasi class, your lactating mothers, possible yan na pwedeng mag-travel yan into your para, tawag dito, possible yan na ma-ingest din ng baby. Okay, for them to develop possible pseudomembranous colitis or C. difficile. Okay, ang nakalagay din dito, no, your ertapenem, okay, your ertapenem is not recommended for use in patients younger than 18 years of age natin. Okay, so I have here yung iba't ibang adverse effects natin in your GI tract. Okay, of course, sabi natin, pwede kang magkaroon ng pseudomembranous colitis or your C. difficile diarrhea. Okay, Clostridium difficile. Yun pang ibig sabihin ng C. difficile natin. Ayusin ko yung sulat ko. We have your Clostridium difficile diarrhea. Okay, due to your antibiotics or due to that bacteria or because nasira ang ating normal flora. And of course, possible na mga nausea and vomiting natin. That can actually lead to what? Pag magkaroon ka kasi ng GI tract effect, it can actually lead to possible or serious dehydration. And of course, electrolyte imbalances. And of course, aside from that one, possible din po na meron siyang CNS effect. Ano yung mga CNS adverse effect natin? Of course, marami yan. We have your headache, mga ganyan. Okay, mga dizziness, and even altered mental state. So, usually class, no, itong ating mga Carbapenems, actually, nagkakaroon po ng there are reports, no, that possible na magkaroon kasi ng seizure yung patient natin because of your Carbapenems. Okay, if you're going to combine this antibiotic with other drugs. Kaya importante na dapat alam din natin yung mga drug-to-drug interaction natin or kung ano yung mga medication na hindi pwedeng ipagsabay sa mga ganitong klaseng antibiotic natin. Therefore, kapag possible na magkakaroon ng seizure yan, what you are going to do as a nurse, you have to monitor your patient. And of course, aside from that one, your priority, you have to provide safety measures. If any of this, okay, pangit ng sulat ni sir, safety. Okay, yan po yung number 1 priority natin kapag nagkakaroon pa ng possible CNS adverse effects yung patients natin. That is your Carbapenems. Any antibiotics that end with a suffix na penem, they are your Carbapenem. Ano yung mga yun? We have your Doripenem, your Ertapenem, your Meropenem, and your Imipenem. Anong ginagawa ng Carbapenems natin? They inhibit cell membrane synthesis that leads to cell death, and they are considered as what? Broad-spectrum antibiotics. They are effective against gram-positive and gram-negative bacteria. And aside from that one, sabi natin your Doripenem is the newest drug of the class of this klase ng antibiotic or your Carbapenems natin. Okay? Next naman tayo here with your Cephalosporins. Okay? Your Cephalosporins class, they are what? They are both bactericidal and bacteriostatic. Nakadepende po yan sa mismong dose, use, and specific drug involved natin. So usually class, itong mga pag sinabi natin Cephalosporins yan, class, they are considered as what? They are effective against broader spectrum of bacteria. Okay? And aside from that one, okay, marami po kasi tayong, tawag dito, marami kasi tayong mga generation, no? Ito yung maraming klase or maraming generation yung mismong antibiotic na to. Okay? And they are indicated for what? In susceptible species, these agents basically interfere with the cell wall building ability of the bacteria when they divide. That is why they can actually prevent the bacteria from biosynthesizing the framework of their cell walls natin. Okay? So, ano usually yung mga generations natin, sir? Ano usually yung mga generation natin? Bakit meron pong generation tong ano natin? Usually, class, tong cephalosporin natin, kaya meron po silang, na-divide sila into iba't ibang generation kasi they are, para na-determine po natin yung mismong effectivity nito, no, against sa isang broader spectrum ng isang bacteria. Okay? Or pwedeng possible na magkakaroon kasi ng increase dun sa mismong resistance, no, dun sa destruction ng ating mga beta-lactamases or yung naproproduce mismo ng enzyme ng ating mga bacteria na inhibit mismo yung action ng antibiotics natin. Or, mismo also with, kaya may generations mo itong ating mga cephalosporins. Nakadepende kasi yan sa mismong increased ability ng ating mga cephalosporins to also reach your central, your CSF or your cerebrospinal fluid natin. Okay? So, palagi nating tatandaan, class, your cephalosporins, it is important for us to reserve cephalosporins, so hindi po yan agad-agad na pwedeng ibigay. Okay? For appropriate situation, because cephalosporin-resistant bacteria are appearing in increasing numbers. Hindi po palaging first sort ang cephalosporin natin. For reservation po yan. Kapag hindi tumalab yung ibang antibiotics, or kapag nagkaroon ka ng possible hypersensitivity reaction sa mga ibang antibiotics, you can actually use your cephalosporins natin. Okay, kasi class, usually 10% of persons allergic to penicillin. Okay, once na you're also allergic to penicillin, possible din na magiging allergic ka sa mga cephalosporins. You have to remember that one kasi lumabas yan sa exam. May question na ganito. Okay, which kaninong patient ang hindi pwedeng contraindicated with your cephalosporins. Of course, kapag sabi natin, tawag dito, automatically kapag allergic ka sa penicillin, possible din na pwedeng allergic ka din sa cephalosporins natin. Excuse me. Bakit, sir? Bakit nagkakaroon ng bakit masasabi mong allergic ka din? Pag once allergic ka sa penicillin, allergic ka na rin sa cephalosporin, it's because both groups of your antibiotics, they actually have a similar molecular structure. Okay? So, next here, we have here your generations ng ating mga cephalosporins natin. Okay, nakalagay dito. Number 1, we have your first generation. Kailangan yung i-memorize to, class. Okay, number 1, we have your what? We have your cefadroxil, your cefazolin, and your very common na cephalaxin. They are under your first generation natin. Okay, aside from that one, we also have here your second generation naman po. Yung mga second generation natin, we have number 1, we have here your cefaclor, we have your cefotetan, your cefoxitin sodium, your cefrazil, and of course, your cefuroxime natin. Okay, they are under your second generation natin. And aside from that one, we also have here, for your third generation, we have your cefdinir, cefixime, cefotaxime, cefodoxime, ceftazidime, ceftriaxone, ceftibuten, ceftidoterin, and your ceftazidime and avibactam, or this one is actually a combination na na bacteria yan. Antibiotics, I should say. And for your fourth generation, we have your cefipime. And last, for your fifth generation, we have your ceftaroline fosamil and a combination of your ceftazolane and your tazobactam natin. Okay? Ang kailangan lang natin i-memorize dito tayo sa cephalosporin coverage natin. Okay? I'm so sorry. For your first generation, ang ating memory tips is your peak. Ano usually yung kayang patayin or kayang inhibit or nagiging effect or kung ano yung mismong effect, kanino effective usually ang ating mga cephalosporin sa mga organism na to. Pag first gen yan, ang ating kailangan yung memory tips is your PEC. Okay? That is actually a mnemonic device to remember which bacteria are actually susceptible to this first generation cephalosporins. Ano ba yung mga yun, sir? Number 1, gram-negative bacteria is your what? Your Proteus. Okay, your Proteus mirabilis. And aside from that one, we have your E. coli. And of course, last we have your Klebsiella pneumoniae natin. Para hindi natin makalimutan, kaninong largely effective against ang ating mga first generation cephalosporin. Effective yan sa ating mga gram-positive bacteria. Ano ba yung mga gram-positive bacteria natin? We have your PEC. We have your Proteus mirabilis, we have your E. coli, and your Klebsiella pneumoniae. Naintindihan natin? Okay, for your second generation naman po, this cephalosporins actually are effective against what? Previously mentioned strains natin. Ano ba yung mga yan? We have your H. influenzae or your Haemophilus influenzae, your Neisseria gonorrhea, Neisseria mga Neisseria species natin, and of course, also with yung na-mention na natin na strains, we have your PEC. Okay? So, we have yung PEC natin, we have your Proteus, E. coli, and your Klebsiella. So, these are what? This second generation, they are less effective kasi yan against sa mga gram-positive bacteria natin. Okay? They are less effective compared sa ating mga first generation natin. Okay? Para hindi natin makalimutan, pag second generation, they are effective to your H and PEC. Okay? Your Haemophilus influenzae, your Neisseria species, and of course, yung PEC natin. And of course, for your third generation naman po, these are effective against all the previously mentioned strains natin, lahat ng to. Okay? And they are relatively weak against gram-positive bacteria, but always remember this one, your third generation class, they are actually more potent, no? Or ibig sabihin, mas malakas po sila against sa mga gram-negative bacilli natin. Okay, and of course, aside from mga Serratia, Marcescens natin. Okay, we have your Enterobacter, ano pa yung mga yan? We have your Citrobacter, your Serratia, and plus your PEC and HN. Okay, or your HN and PEC, or ibig sabihin, pag third generation cephalosporin, effective din sa ating mga hen PECs natin. Okay, yung na-mention natin ng mga strain, and of course, with this one, we have your Enterobacter, your Citrobacter, and last, we have your Serratia species natin. Okay, I mean Serratia marcescens natin. And for your fourth generation naman po, lahat na po yan ng na-mention natin na mga strains natin kanina. We have your henpex natin, plus effective po yan sa ating mga Pseudomonas na klase ng bacteria natin. They are also effective, wait lang class. At ang mga pusa ko ay, wait lang po. Sorry. Okay, they are also effective from your Pseudomonas na mga bacteria natin. They are effective against negative, gram-negative and also with your gram-positive organisms natin. Okay, and of course, we also have here your fifth gen naman po. They are effective against what? They are effective from your positive MRSA natin. Okay, or yung mga extra MRSA coverage bacteria natin, effective po ang ating mga fifth generations natin na cephalosporins natin. Okay, here, we have here your possible adverse effect of your cephalosporin. Okay? Sabi natin kanina, possible din na magkaroon ng GI tract effects. Okay? Yung tinatawag natin kanina na pseudomembranous colitis natin. Diba? And this is actually a potentially dangerous disorder and also has been reported with some cephalosporins din. Kasi usually talagang effect ng ating cephalosporin. Ang effect talaga niyan, class, is what? GI effect talaga yan. GI tract effects talaga ang possible side effects and adverse effects natin. Okay, aside from that one, we also have your CNS effect. They are actually, ano ba yung mga symptoms nito? Possible na magkaroon ka ng headache, mga ganyan, dizziness, and even with your lethargy, and even possible paresthesias. Ibig sabihin, paresthesias yung parang magkakaroon ka ng pamamanhid, wala kang mararamdaman. Okay? And of course, automatically yan, they are nephrotoxic. Okay, they are associated with the use of your cephalosporins, no? Kaya it's very important for us to assess, no? Kapag meron siyang predisposing renal insufficiency or may problem siya sa mismong kidney natin. And of course, aside from that one, we also have here your super infection natin because of the death of your protective bacteria or of your normal flora na tinatawag natin. Ngayon, kapag nagkaroon ka ng GI tract effects, of course, ano lang naman ang kailangan natin gawin? You have to what? You have to, tawag dito, kailangan natin ibigay yan with meals. Okay, para hindi ka magkaroon ng ano. And of course, you have to treat your symptomatic ano natin, yung mga nausea and vomiting natin, no? And aside from that one, kapag meron namang CNS effect yan, sabi natin pag CNS effect yan, ano yung priority natin? Kailangan natin what? Mag-provide ng safety. Okay, we have to take safety precautions, no? Like for example, kapag possible yan na nagkakaroon ng headache, nagkakaroon ka ng, ano ba yung mga kanina, possible na dizziness, of course, we have to change our position slowly, no? Para makapag ano tayo, if nagkaroon ka ng CNS effects because of these drugs. And of course, sabi natin sa possible na lethargy or dizziness, of course, you have to instruct your patient to avoid mga hazardous activities natin. Okay? And for your nephrotoxic, kapag nephrotoxic yan, anong kailangan natin gawin? You have to ensure your patient is always hydrated at all times. Okay? Para makapag-minimize tayo ng renal toxicity from this type of antibiotics natin. Okay? And aside from that one, next we have here your fluoroquinolones naman natin. Ano naman tayo? Okay? We have your fluoroquinolones. Okay? Pag sinabi natin fluoroquinolones, nakalagay dito, they are relatively new synthetic class of your antibiotics. Ito yung mga bagong antibiotics natin, your fluoroquinolones, no? Okay? And aside from that one, okay, with a broad spectrum of activity. Okay, ang kanyang mechanism of action, they interfere with the action of DNA gyrase or DNA enzyme natin. Okay, yung ating class kasi, yung ating DNA gyrase or this enzyme, they are actually essential, no? Para magkaroon ka ng replication of your DNA or para magkaroon ka ng growth and reproduction of your bacteria. Okay, so your fluoroquinolones actually class, they are indicated for treating infections caused by susceptible strains of gram-negative bacteria or even gram-positive bacteria natin. Okay, nakalagay dito, in 2001, it was approved for the prevention of your anthrax infection. Diba? We have again a case of your anthrax that patient from Santo Niño, no? So usually, itong fluoroquinolones natin class, they usually use it against your anthrax infection. Okay, in areas like meat be exposed to germ warfare. Kasi yung anthrax natin, plus ginagamit din yan as, tawag dito, molecular or biological na weapon during war. Okay? And of course, aside from that one, anthrax infection, your fluoroquinolones as well is also effective against typhoid fever natin. Okay? And your fluoroquinolones are being absorbed from your GI tract, metabolized in the liver, and excreted in your urine and feces, and they are widely distributed in the body and can actually cross what? It can cross your placenta and even enter your breast milk natin. Okay? So, your fluoroquinolones actually include what? Ano ba yan? Sorry, class, nila na naman ang aking mga pusa. Ginugulo na naman nila ako. Okay? Your fluoroquinolones actually include what? We have your hashtag clom. Okay? We have your hashtag clom natin. Number 1 for your letter C. Anong letter C natin? We have your what? Ciprofloxacin. Ciprofloxacin. For your letter L, we have your levofloxacin. Okay, wait lang class. Tanggalin ko lang po yung pusa dito sa may table ko. Wait lang. Hindi ka man. Hindi mo tikas tuyo. Wait lang. Dito ka. Dito ka muna, okay? Mag-ano ka muna dito. Sakarin. Maglaro ka muna dito. Okay. Ala. Okay, class. Okay, let's continue. Sorry, class. We have your levofloxacin natin. For your letter O, we have your what? Ofloxacin. And for your letter M, we have your moxifloxacin. Okay, we have your, basta meron tayong end na floxacin, they are under your what? Fluoroquinolones. Ano yung mga yun? Number 1, we have your Number 1, for C, you have reciprofloxacin. L for levofloxacin. O for ofloxacin. And for your letter M, you have your moxifloxacin natin. So, ito yung mga common na fluoroquinolones natin. Ngayon, kanina dapat contraindicated or we have to take precaution when we're going to give this type of antibiotic. Okay, nakalagay dito, fluoroquinolones are contraindicated with patients to known allergy, of course, to any fluoroquinolone, and of course, ito, pregnant or lactating patients. Kasi sabi natin kanina, it can actually cross your placenta and enter your breast milk natin. Ngayon, okay, yung ating mga it can actually lead to what? Because it can have a potential effects on the fetus and infant are not known. Ibig sabihin, possible yan na teratogenic sa mga pregnant patient natin. That's contraindicated po itong ating mga fluoroquinolones natin. And aside from that one, your fluoroquinolones as well is actually what? Used with caution with the presence of your renal dysfunction, which could interfere with the metabolism and excretion of your drugs natin. And lastly, they are not recommended, they are not recommended for use in children younger than 18 years old or years of age natin. Bakit hindi po yan recommended yung ating mga fluoroquinolones sa ating mga 18, younger than 18 years of age natin? It's because, okay, yung ating drugs na to, they are what? They are associated with the lesions. Okay, sorry. Susulat. Lesions in developing cartilage natin. Or possible na nagkakaroon ka ng problem sa mismong, pangit ng sulat ni sir, problem sa mismong mga cartilages natin. Kasi of course, kapag 18 years old ka, nagde-develop pa lang yung mga structure natin, yung mga bones natin. Therefore, they are not recommended to patients with to children younger than 18 years of age natin. Okay? So, we have here iba't ibang adverse effects natin. Of course, automatically yan class, CNS effect talaga yan. Possible na pwede ka magkaroon ng headache, okay? Mga dizziness or possible insomnia and even depression. Okay? And for your GI effects naman, okay, mayroon mga nausea and vomiting. Ano pa, di ba? Halos pare-pareho lang yung mga yan, even with your diarrhea, no? Kasi nga, tawag dito, yung talagang mismong direct drug effect ng ating fluoroquinolones in our GI tract. Okay, aside from that one, for immunological effects naman, class, of course, it can actually cause what? Yung paulit-ulit na bone marrow depression. Okay, and aside from that one, of course, you also have here your photosensitivity. You have to remember this one, okay? Your photosensitivity because, bakit possible ka na magkakaroon ng photosensitivity? It's because of your fluoroquinolones. Ano dapat na maging instruction mo sa patient mo? You need to what? Number 1, you need to avoid, of course, avoid sun and even ultraviolet lights natin, exposure. And of course, aside from that one, we can actually instruct our patient to use a protective clothing and even with your sunscreen. Kasi number 1 effect ng ating fluoroquinolones is what? Photosensitivity. Okay, ulitin natin. Pag sinabi natin fluoroquinolones, okay, they are your medications that ends with what? Floxacin. Diba? Ang ating mnemonics for that one, we have your clom. And tatandaan ninyo, ang ating fluoroquinolones, they interfere with what? DNA enzymes natin. Okay? So, next naman tayo here with your, next we have your penicillins and your penicillinase resistance natin. Antibiotics natin. Okay? So, we have here your number 1. Okay, your penicillins and penicillinase resistant antibiotics, they usually produce what? Bactericidal effects by how? By interfering with the ability of susceptible bacteria to build their cell walls when they are dividing. Okay, tandaan natin, class, yung penicillin kasi natin, class, they are actually natural antibacterial agent. Okay, saan po nanggaling itong mga natural antibacterial agent natin? They came from what? Galing po sila sa isang mold. Okay, they came from mold. Okay, they are being obtained from that mold na tinatawag natin na genus Penicillum. Okay, that is your genus. I guess alam niyo to kasi nag-micropara na kayo. Genus Penicillium. Okay, we have your genus Penicillium natin. Wherein, yung genus Penicillium natin, class, ginagamit po natin to during what? During your World War II. Okay? Kaya tinatawag natin yung mga penicillin natin, they are miracle drug, no? Kasi during World War II, hindi sila usually namamatay dahil sa namamatay sila dahil sa infection. Okay? Because of their wounds, diba? Namamatay talaga sila because of infection. Kasi nga, kaya sinatawag nilang miracle drug tong penicillin natin during that era. Okay? And aside from that one, these penicillins kasi, meron kasi silang tinatawag na beta-lactam ring structure. Therefore, kapag yung mga bacteria natin or mga microorganisms natin, they can produce beta-lactamase. Of course, hindi po pwedeng ibig ang beta. Ang ating penicillin kasi hindi yan magiging effective. Okay? And aside from that one, it is indicated for the treatment of your streptococcal infections, including pharyngitis, tonsillitis, scarlet fever, endocarditis, and of course, pneumococcal infection. We have your staphylococcal infection as well, your spirochetal infections, rat bite fever, diphtheria, diba? Anthrax, syphilis, and of course, uncomplicated gonococcal infections natin. Ang kinakalagay dito, they are what? They are sensitive to gastric acid levels in our stomachs and should be taken with what? On an empty stomach. Okay? Ibig sabihin nun, hindi po sila nakakasurvive sa mismong gastric acidic level ng ating GI tract or ng ating stomach. Therefore, kailangan pong empty stomach mo natin ibigay ang ating penicillin para mas maganda ang ating absorption. Okay, and aside from that one, we also have here your if penicillins and penicillin-resistant antibiotics are taken concurrently with tetracyclines, a decrease in effectiveness of penicillins result. Ibig sabihin, hindi po natin pwedeng ibigay ang penicillin if your patient is also taking what? Tetracyclines. Kasi hindi yan magiging effective sa ating katawan. Or hindi niya ma-reach yung mismong therapeutic level ng ating penicillin. Okay, so we need also to discuss yung natin, yung may iba't ibang klase ng penicillin natin. Of course, we have your basic penicillins, your broad-spectrum penicillins, your penicillinase-resistant penicillins, and of course, we have your extended-spectrum penicillins natin. Okay, under your basic penicillins, okay, we have here your penicillin G, procaine, your penicillin G, benzathine, your penicillin G, and of course, you have your penicillin V, potassium natin. And aside from that one, we also have here your, tinatawag natin for broad spectrum. Ayan, nandito na po yung mga amoxicillin natin, class. Your amoxicillin, your amoxicillin clavinate, okay? And of course, we also have your ampicillin, and of course, yung combination antibiotics natin, or penicillin natin, we have your ampisol, or yung tinatawag natin na ampicillin sulfactam natin. Okay, always remember this one, class. Your amoxicillin, sabi natin kanina, no, yung mga penicillin sa atin, they are very sensitive to our gastric acid level. But, your amoxicillin actually, class, they are unaffected by food intake. So, pwede mo lang siyang i-take kung mayroon ka maglaman ang tiyan natin or wala. Okay? Kasi they are unaffected by food intake, itong mga amoxicillin natin. Okay? And aside from that one, we also have here your penicillinase-resistant penicillins natin. Okay? We have here your dicloxacillin, sodium, your nafcillin, and your oxacillin, sodium natin. And lastly, we have here yung mga extended spectrum penicillins natin. I'm so sorry. Yung tinatawag natin na peptides. Okay, favorite to ng mga nurses natin. Bakit, sir? Kasi ang hirap-hirap po itong i-dilute or i-reconstitute, class. Mahirap po siyang i-prepare. Masakit po siya sa kamay. Okay? We have here your piperacillin tazobactam or your peptides na tinatawag natin. Okay? So, next here, okay? Ano yung mga contraindications natin ng ating penicillins? Of course, we have here, number 1, we have your use with caution in patients with hepatic or renal impairment. Di ba parang very paulit-ulit lang siya? Kasi nga, usually naman sabi natin, yung mga yung mga penicillin natin, they are actually what? They are they are hepatotoxic and nephrotoxic na tinatawag natin. Okay? And aside from that one, we have here, used in patients who are pregnant and lactating patients should be limited to situations. Bakit, sir? Bakit kailangan limitahan natin yung paggamit ng ating penicillin if your patients are pregnant? It's because, of course, sabi natin, possible, yung ating mga penicillin, they can actually have what? They can actually, they can be teratogenic at some point. And of course, yung mga mother natin clearly would benefit from the drug. Of course, because yung mismo diarrhea and super infections may also occur in your infant if they are if they are lactating, no? Possible na may transmit mo yan sa ating mga infant na pinapadede natin. That is why you have to take caution, or we have to be cautious when we're going to administer your penicillin to our pregnant client natin, or even with your lactating clients natin. Okay, wait lang, class. Grabe talaga ang pag-istorbo ng mga pusaret na ito. Doon ka muna. Doon ka muna. Okay? So, we have here your adverse effects of your possible adverse effect of your penicillin. Number 1, we have here your what? We have here your we have here your GI tract GI tract effects natin. Of course, usually class, ito kasi yung pinaka-major, no? This is the major adverse effect of your of your penicillin class. Your GI tract, or your mismong GI tract. Ano ba yung mga common adverse effects natin? It includes yung mga nausea again, yung mga vomiting, your diarrhea, mga ganyan. Okay, and aside from that one, we have here your hypersensitivity reactions. Kapag hypersensitivity reactions, and possible yan na mga allergic reactions, like yung mga kahit simpleng rashes lang yan. Okay, with the repeated exposure kasi, possible na pwede kang magkaroon ng anaphylaxis. Okay, pag hindi na-treat yan, and of course, it will lead to what? Anaphylactic shock and death. Okay, that is your penicillin natin. Sabi natin kapag, since hepatic and renal, it can have you can have a hepatic or renal impairment, of course, ang kailangan talaga nating i-consider, we have to instruct your patient to drink a lot of fluids. Okay? And of course, kapag sabi natin hypersensitivity reaction, you have to what? You have to instruct your patient to report kapag nagkaroon sila ng mga rashes or even difficulty in breathing. Okay? So that is your penicillin natin. Next naman tayo here with your wait lang class. Tanggalin ko lang yung pusa ulit. Dito ka muna. Okay? Here. Ano ba? Okay, we have here your tinatawag natin na sulfonamides naman po tayo. We have here your sulfonamides naman po. Okay, pag sinabi kasi natin sulfonamides yan class, they are yung tinatawag natin na sulfa drugs, and ang kanyang mechanism of action, always remember this one. It inhibits your what? It inhibits your folic acid synthesis natin. It inhibits your folic acid synthesis natin. Okay? So your sulfonamides class, they are actually effective against gram-negative and gram-positive. Ibig sabihin, they are both spectrum antibiotics, no? Such as your what? We have your chlamydia, your trichomatis, chlamydia trichomatis, your nocardia, and some strains of your Haemophilus influenzae, your E. coli, and your Proteus mirabilis. Okay? And your sulfonamides are what? Teratogenic. Therefore, pag teratogenic yan, pwede man natin ibigay yan sa mga pregnant client natin? Of course, hindi. Balik tayo sa ating folic acid. Okay, your folic acid class, they are actually a requirement, no? They are being required by our cells para magkaroon po tayo ng biosynthesis ng ating mga RNA, ng ating mga DNA and protein. Yun po yung importance ng ating folic acid natin. Okay? So, they can actually be what? Your, tawag dito, your sulfonamides, they can actually be used as alternative drug, no? Okay? They can actually be used as an alternative drug sa mga patient na mayroong penicillin allergy. Okay? Ito po yung ginagamit natin or other resort natin kapag si patient nagkaroon ng allergic reaction or hypersensitivity reaction sa penicillin natin, we can actually use your sulfonamides. Okay? So your sulfonamides, usually it includes what? Okay? We have your mga sulfa drugs to class. Basta may sulfa yun, automatically sulfonamides yan. Okay? We have here your sulfa. Ano yung unang sulfa natin? We have your sulfadiazine. Next, we have your sulfa again. Sulfasalazine. Of course, we have here your trimethoprim sulfamethoxazole or yung tinatawag natin na cotrimoxazole natin. These are your sulfonamides. Ulitin natin, we have your, basta may sulfa-sulfa yan, they are your sulfonamides. We have your sulfadiazine, sulfasalazine, your trimethoprim, sulfamethoxazole, or your cotrimoxazole natin. Okay, so here are the contraindications and cautions when we are going to administer your sulfonamides. Number 1, okay, they are contraindicated in contraindicated during pregnancy because these drugs actually can what? They are teratogenic. Okay, they can actually, pag sinabi ng teratogenic, possible, it can cause birth defects. Okay, sulat natin, birth defects. As well as yung tinatawag natin na kernicterus. Okay, madidiscuss naman itong pangit na ng sulat ni Sir. Medyo nag-ano yung paningin ko. Kernicterus. Okay, during your lactation, okay? During lactation kasi hindi ka talaga pwedeng mag-take ng ano, kasi pwede mo matransmit yan sa infant, okay? Mas mataas yung mismong risk mo for kernicterus and even with your diarrhea sa ating mga infant, okay? And aside from that one, they should be used with caution in patients with renal disease or history of your kidney stones. Okay? History or, possible, tawag dito, kidney stones or renal diseases. Okay? Yun po yung ating mga sulfonamides natin. Therefore, usually class yung sulfonamides natin kasi with this kidney stones, possible kasi yan na mag-cause yan ng tinatawag natin na crystalluria. Therefore, kapag possible na mag-cause yan ng crystalluria, ang number 1 lang naman na kailangan mo instruct sa patient mo, you have to you have to instruct your patient to increase your oral fluid intake nila. Okay? And aside from that one, we also have here your adverse effects naman po tayo. Okay? We have here your renal effects. Sabi natin, it is because of the filtration ng drug natin in our glomerulus. Of course, possible yan na magkaroon tayo ng crystalluria and even with your hematuria. Okay? Na ibig sabihin ng hematuria natin, possible, merong presence ng red blood cells in our urine. Okay? And of course, we have your CNS effect. Of course, ano ba yung mga yan? We have your headache, mga ganyan, dizziness, mga vertigo, mga ganyan. Okay? And aside from that one, we also have here your GI effects such as what? Paulit-ulit, nausea and vomiting, diarrhea, mga abdominal pain, mga ganyan. And of course, for your immunologic effect, possible din na bone marrow depression in related to the drug effects on the cells of your bone marrow natin. Diba sabi natin nagkakaroon ng direct effect yung ating mga antibiotics sa mismong rapidly dividing cells natin. Okay? And of course, we have here last your dermatological effects natin. Kasi it includes what? Photosensitivity yan. Photosensitivity. Therefore, kapag nagkukasi ng photosensitivity, ano ulit yung mismong ano natin? Wait lang yung pusa ulit. Ano yung mismong ano natin? Yung mismong intervention natin? Kailangan niyang mag-wear ng protective barrier clothing and of course, avoid exposure. Exposure to sunlight or ultraviolet lights natin. Okay, that is your sulfonamides natin. Anything that ends with, pag meron kong sulfa na narinig, automatically yan, sulfonamides yan. Okay, next we have here your tetracyclines naman po tayo. Okay, wait lang class. Doon ka muna, baby. Doon ka muna. Ano ba? Okay, we have here your tetracyclines naman po tayo. Okay, we have here your tetracyclines. Wait lang, class. Okay, wait lang po. Diyan ka muna. Okay, we have your tetracyclines. Okay, but before that one, may nakalimutan si sir. Bago tayo mag-proceed with your tetracyclines, kailangan ninyo yung maintindihan yung mga pusa kasi nadidistract ako. Pasensya na po. Okay? When we are going to give your, tawag dito, sulfonamides, meron kasi tayong tinatawag na cross-sensitivity. Okay? Pag sinabi kasi natin cross-sensitivity in class, ibig sabihin lang nun, nagkakaroon ka ng hypersensitivity reaction sa mismong gamot. Ibig sabihin nun, pag cross-sensitivity, automatically class, kapag ikaw nagkaroon ka ng allergic reaction sa isang sulfonamide, automatically, possible din na magkakaroon ka ng reaction sa ibang klase ng sulfonamide. For example, nagkaroon ka ng tawag dito ng hypersensitivity reaction sa ating sulfadiazine. Automatically yan, possible din na kapag nagbigay ka ng ibang klase ng like your sulfatametoxazole or your quatrimoxazole, pwede din na allergy ka sa isang klase ng sulfonamides natin. Okay? And aside from that one, we have here your tetracyclines. Okay? But before we're going to proceed that one, sabi natin crystalluria. Bakit possible na magkakaroon ka ng crystalluria? Kasi usually yung mga ano natin, yung mga sulfonamides natin, they are what? Insoluble sa ating urine. Insoluble sa ating acidic urine. Kaya siya nagkakos ng crystallization or pamumuo ng mga ano natin. Okay? And aside from that one, we have here your tetracyclines naman po tayo. Okay, your tetracyclines, ito pa yung mga unang antibiotic natin. Okay, yan pa yung mga tetracyclines natin. And aside from that one, they are broad spectrum antibiotic effective against gram-positive and gram-negative bacteria by how? By inhibiting your bacterial protein synthesis natin and have a bacteriostatic or static effect natin. Okay, yung tetracyclines natin class, galing pa sila or nag-originate po sila sa tinatawag natin na Streptomyces. Okay, Streptomyces orophaciens in the year 1948 or your Streptomyces orophaciens in 1948. Kaya nga sabi natin, they are your first broad spectrum antibiotic natin. Okay, your tetracyclines class, okay, they are actually effective or indicated for treatment of infections caused by Ricochet, Mycobacterium pneumoniae, Borrelia recurrentis, Haemophilus influenzae, Haemophilus ducreyi, and whatsoever. Lahat po yan, they are effective. Okay, they are against this kind of infections natin. Your tetracyclines natin. Okay? So, your tetracyclines, para hindi siya makalimutan, your tetracyclines include what? Hashtag TDDM. Okay, TDDM, tetracyclines, TDDM, ano yung mga yun? Number 1 for letter T, we have your what? Tetracycline. Okay, for your letter D, we have your what? We have your doxycycline. And for another one, letter D, we have your Demexo or Demeclo. I'm so sorry, ang pangit ng surat ni sir. Grabe. Hindi niyo siya naiintindihan, okay? Tetracycline. For your letter D, we have your doxycycline. For your letter D, we have your Demeclocycline. And for your letter M, we have your Minocycline. So they are your tetracyclines. Hashtag TDDM. For T, we have your tetracycline. D for doxycycline. D for demeclocycline. And for letter M, we have your minocycline. Okay, their absorption is affected by food, from your iron, your calcium, and other drugs in your stomach. Therefore, itong mga tetracyclines sa to class, hindi siya pwedeng ibigay sa mga patients na nag-take ng iron kasi possible na magkakaroon niya ng drug-to-drug interaction or food-to-drug interactions like with your iron and calcium natin. So your tetracyclines are concentrated in the liver and excreted unchanged in your urine. And for patients, who are actually using your who are taking oral contraceptives, they should be advised to use an additional form of birth control while receiving this tetracycline. Kasi class, itong tetracycline natin class, dinidecrease niya kasi yung mismong, yung mga oral contraceptives natin class, dinidecrease na yung mismong desired action if taken with your tetracyclines. Or ibig sabihin, possible na pag magbuntis, pwede ka magbuntis kahit nagtitik ka ng contraceptives, no? If you're taking your tetracyclines. Kasi dinidecrease niya po yung mismong desired action ng ating mga oral contraceptives natin. Yung ating mga tetracyclines natin. Okay? So, bakit sabi natin kanina, sir, bakit affected po yung mismong absorption ng gamot na to by your food? Of course, it's because, tawag dito, your antacids, no? Okay, yung mga drugs natin dito muna, your antacids class, they shall decrease yung mismong natin. Piniprevent niya mo mismo yung mismong absorption ng gamot natin. Yung mga antacids natin, hindi pa siya pwedeng i-take together with your tetracyclines. And of course, with your iron din, napiprevent din po yung mismong natin, absorption yan class. Of course, with your calcium. Ano ba yung mga pagkain natin or food natin that are, drinks that are rich in calcium? Of course, your milk, di ba? They can actually inhibit yung mismong absorption ng tetracyclines natin. Kaya dapat kailangan yung tignan yun kung si patient, possible ba na nagtitake ng iron supplement, possible ba na nagtitake ng antacids, of course, it will greatly affect yung mismong absorption ng tetracyclines natin para maging effective. Okay? Okay, so your tetracyclines, they are contraindicated to patients with pregnancy and lactation. Okay, because of the effects of developing what? Bones and teeth. Okay, yun po usually yung ng tetracycline natin class. Kasi, tawag dito, your tetracyclines class, it greatly affects yung mismong bone and teeth development of your infants. Or your tawag dito mga babies natin. Okay? So, aside from that one, your tetracycline should be used with caution with children younger than 8 years of age. Kasi, of course, kapag pag bata yan, of course, doon pa lang po nagde-develop yung mismong bones and teeth ng mga bata. Therefore, kailangan po talaga na, what you call this one, kailangan po na mabantayan natin. Okay? Kasi possible yun na masira yung mismong developing bones and teeth ng patient natin. Aside from that one class, yung tetracycline natin, it can actually cause what? Staining kasi yan. It usually causes yellow discoloration sa ngipin natin. Okay? So, of course, kapag ganun, tawag dito, if you're going to take your tetracycline orally, kailangan mong gumamit ng straw para hindi mag-stain yung ngipin natin. That is your tetracyclines. And of course, contraindicated with with hepatic or renal dysfunction. So, automatically naman yun. Kasi nga, usually class, itong effect ng ating mga antibiotics, they can actually cause what? They can actually cause nephrotoxicity and your hepatotoxicity natin. Okay? Next naman tayo here with your adverse effect. Number 1, we have your GI effects tayo. Dito tayo sa ating GI effects class. So, ang ating GI effects, okay? Ano ba yung mga possible na natin? Of course, major adverse effect kasi talaga pag GI, no? Of course, number 1, yung mga nausea and vomiting natin, like that, your diarrhea. Okay? And aside from that one, we also have here your skeletal effects. Sabi natin, hindi to pwedeng ibigay sa mga children younger than 8 years old or mga lactating mothers natin because if what? Possible na nagkakaroon ng damage to our teeth and bones na to. Okay? Nagkakaroon kasi yan ng because your tetracyclines kasi class, meron kasi tayong tinatawag na affinity sa mga teeth and bones natin. Wherein kapag nag-accumulate yung mga tetracyclines natin sa ngipin and bones natin, nagkakaroon pa ng what? Weakening of our structure. Of course, mag-weaken yan or hihina po yung mismong structure niyan. Okay? That results what? Sabi natin kanina, staining sa ngipin and even with your bones ng patient natin. Okay? And of course, we have here your hematological effects. Okay? Usually, class, meron ding hematological effects tong mga tetracyclines natin. It can actually cause what? Possible hemolytic anemia. Okay? Marami kasing klase ng anemia. Hemolytic, microcytic, or whatsoever. And even with your bone marrow suppression or depression natin. Okay? And lastly, we have also your hypersensitivity reaction. Okay, kailangan talaga nating kailangan talaga nating i-instruct sa patient na kahit possible na nagkaroon ka man ng rashes, no, or urticaria, kailangan talagang i-report yan sa ating attending physician para ma-determine natin na possible na nagkakaroon ka ng what? Nagkakaroon ka ng hypersensitivity reaction or dangerous adverse effect of this medication. Okay, so that is your tetracyclines tayo. Last tayo, we have your macrolides naman po. Okay, we have here your macrolides. So your macrolides class, okay, they can actually be bactericidal or bacteriostatic. Yan. They can be bactericidal or bacteriostatic, and they usually exert their effect by binding to what? Binding to bacterial cell membrane and changing protein function natin. Okay, ibig sabihin to, they are actually mga broad spectrum itong mga natin, itong mga macrolides natin. And your macrolides, they are being used for the treatment of infections in patients allergic to penicillin. Same with yung kanina na-discuss natin na unang antibiotic. Kapag nagkaroon ka ng allergic reaction sa penicillin, pwede kang gumamit ng macrolides. And this is actually the what? DOC for treatment or drug of choice of your Legionnaire's disease, infections caused by Corynebacterium diphtheriae, urea plasma species, syphilis as well, Mycoplasma pneumoniae, pneumonia and chlamydial infections natin. So your macrolides, sabi nila, they can actually be used for what? Prophylaxis for endocarditis. Okay, ibig sabihin ng endocarditis, nagkaroon ka ng possible na infection or nagkakaroon ka ng infection in the endocardium. Okay? So, okay, bago tayo mag-undergo ng dental procedures, okay, you have to take your macrolides as a prophylaxis. Okay, in patients with valvular heart diseases, kasi ito usually yung nagiging result ng ating, pag nagkaroon ka ng inflammation dun sa mismong endocardium mo, possible na magkakaroon ka ng valvular defect. Okay, sa mga valves natin. And of course, patient who are allergic to penicillin natin. So, para hindi natin makalimutan, class, yung ating yung ating, what you call this one, yung ating mga macrolides natin. We have here your ACDEF. Okay, we have your ACDEF natin. Number 1 for letter A, of course, we have your azithromycin. We have your azithromycin. Next, we have your letter C. We have your clarithromycin. And for your letter D, we have your erythromycin. And for your letter E, we have your erythromycin. And for your letter F, we have your, for your letter F, we have your what? Erythromycin natin. Basta anything that ends with a thromycin or mycin, they are under your tinatawag natin na macrolides natin. So usually class, itong mga macrolides natin, they are very good, they are actually good for what? They are being used for respiratory tract infection. So usually itong mga indication po ng pag nagkaroon ka ng respiratory tract infections, maganda pong gamitin ang ating mga macrolides. Diba? Kaya sabi ni Sir, diba pag nagkakaroon kami ng ubo, for example, diba ginagawa kasi namin to, no? Okay, although hindi niya siya pwedeng gawin, no? Pag nagkakaroon kami ng possible na naghawaan kami ng sakit sa faculty, like nagkaroon kami ng maubo, automatically yan, azithromycin ang kinakuha namin or tinitake namin. Okay, kasi this macrolides, no, they are very good for the treatment of your respiratory tract infection natin. Okay? And aside from that one, class, ang talagang number one na ang number one effect ng natin, ng mga macrolides natin, they are actually, tawag dito, they are very extremely GI irritant. Tandaan nyo yun ha, they are very GI irritant talaga itong mga natin, itong mga, what you call this one, itong mga macrolides natin. Therefore, of course, kapag GI irritant yan, kailangan mo talagang mag-take ng pagkain if you're going to take your macrolides. And aside from that one, class, yung natin, of course, yung mga contraindications natin and cautions natin, no? We have here your, kapag si patient nagkaroon ng viral or fungal or mycobacterial infection ng eye, bakit contraindicated po yan, sir? Of course, possible kasi na magkakaroon ka ng exacerbation, no, of your symptoms or your mga infection natin because of the loss of bacteria, okay, or the loss of our normal flora. Okay? Possible na ma-exacerbate yung mga mismong mga infection natin if you're going to take this macrolides to patient with viral and fungal or mycobacterial infections of your eye natin. Aside from that one, it should be used with caution in patients with hepatic dysfunction. Of course, pag ganyan, lahat naman ng antibiotics natin, kailangan talaga natin i-check yung mga mismong natin, hepatic mga test natin, hepatic test natin, no? Para, tawag dito, bago tayo mag-proceed with the therapy, kailangan nating malaman para if your liver is actually working, no? Para ma-reduce natin yung mismong dose natin as needed. And of course, okay, use caution with lactating woman because macrolide is being secreted in your, in your breast milk natin. Okay, so kailangan talaga nating yan. Kailangan nating instruct yung patient natin if they are actually lactating. Para maano natin yung mismong pag-take ng macrolides ng patient natin. So, that ends our discussion for today. So, this is just your antibiotics. So, your antimycobacterium, maybe we can actually discuss it during your face-to-face. Okay, so your exam is actually mahirap po siya. So, you have to watch this recorded lecture. Okay, so I do hope na mapapanood niyo po to ng ilang oras ba to? Di ko na alam kung ilang oras ko to ni-record. So, dapat takbusin niyo po siya. Okay, kasi yung mga sinasabi ni Sir, mini-mention niya talaga na binibigyan niya ng ng diin, yun pa talaga yung mga lumabas sa exam. So that ends our recorded lecture. So goodbye everyone.